Great. Thank everybody. Thank all the speakers. I'll finish my part. And nowadays, there's so much progress in data science, technology. So I've been in the field long enough, so I want to present some of my own ideas. And some of those ideas are quite personal. But what I see, the future of psychiatry in this situation. So I'm from University of Alberta, and I've been there for the last 10 years, and before that, working in another two medical schools in Canada. So today, I would like to present three parts. First, talk a little bit the milestone events in psychiatry, just to emphasize how advanced we were and we have been, rather than thinking we are so behind those oncology, cardiology, we're very much advanced, give you some encouragement. And then they present where we are right now in our diagnosis and treatment of mental illness, use depression as an example. And then talk about AI, artificial intelligence, some neurotechnology, what's the impact and what's the future to use those new technology for our mental health care. So the first, just I want to emphasize mental health is so important for everybody. And older people, they have finished their duty in the world and produce children already, pay the tax, and enjoy your retirement. But the most productive member of a society actually from 15 to 55. So during this period of time, it's a major population or target of mental illness. So we have so much to do. I just want to emphasize that mental health is not necessarily a bad thing sometimes. The depression, hypomanic is really related to creativity. Even the Greek philosophy, Aristotle, emphasized many times the inspiration for the great artists mainly come from melancholia or depression or anxiety. And here you see some famous artists, Gauguin and Van Gogh, both hypomanic, sometimes psychotic manic. We also emphasize the mood fluctuation is a part of inspiration and creativity, such as those authors and musicians. And also other artists, Tchaikovsky, that's very popular nowadays with Russian war, and Tchaikovsky. But we know this quite a light-hearted comment about the mental illness. But in reality, majority or almost everybody suffer tremendously in their life, even those high achievers. So let's talk about a little bit milestone technology advance in psychiatry or mental health. You can say early Roman time, they already use ECT. That time, we did not have electricity yet. So the Mediterranean, especially here, use electric fish, try to give those people in labor or seizure 500 volts kind of electric shock with a very small current. So they induce a seizure and to treat manic. So we already have ECT at that time. At that time, we did not have electricity yet. So psychiatry is very much advanced. Another one is the lithium. We know the periodic table by Russian create all those, put all those elements on the table. But lithium, by that time, nobody know what is lithium. As a psychiatrist, Asian psychiatrists already know to use the lithium to treat mania. We do not know. Electricity, we use ECT. We do not know the lithium we use is to treat bipolar already. Another part, the early Islamic hospital in Iraq, Turkey. Even nowadays, we have very famous Turkish bath. And that time, we have those kind of rehab facility and not only use medication or some crude treatment. So we need those kind of hospitals. Certainly in the Dark Age, especially from Christian history, really have a very dark age, and they have persecuted, tortured so many mental illness patients at that time. Actually, years ago, psychiatry is much better than neurosurgery. Actually, use neurosurgeon technique to treat the psychiatry. We already know. Actually, in China, we say we wholehearted. In English, we say fully hearted, wholehearted. We think everything belongs to heart. But that time, the psychiatry already know the idea of demons or spirit is in the brain. So what do? We have boreholes to release those demons and to treat the madness. So we already know the biological psychiatry we started many years ago. And also we have trepanation and that time, and we propose phrenology, transportation, and then phrenology is first kind of a CT-like scanning. So sometimes we call CT called the CAT scan. That time we scan the patient, see what's about your shape of the brain. And then that time I will decide who got a weaker personality that time. So that's the initial CT scan, although we use the brain to scan the patient. And then we have a real biological psychiatry started way beyond almost 1,000 years or hundreds of years. So the Australian psychiatrists use a malaria infection to induce fever, to treat psychosis, and they got Nobel Prize that time. That's a psychiatry got Nobel Prize. Actually, that time to treat psychosis, mainly the psychosis induced by syphilis, actually, that time. Even though there's a biological psychiatry already started. And certainly talking about modern psychiatry, we always have biopsychosocial, right? And the psycho is psychotherapy is mainly dominated by Sigmund Freud. And he got more famous after he escaped from Austria to United States. He was nominated 13 times, I think, for Nobel Prize, but he did not get it. Yeah. So there's some stigma already started for psychiatrists per se. So, yeah. And we also have the RTMS started many years ago. So that time, they gave people drinking high content of iron solution and then use the magnetic stone to move around your body. So that's called RTMS that started already. And also with hypnopathy combined. And the hysteria, that time, and hysteria is they said the worm move around. So what do you do at that time? Use the surgery to take up. Another treatment is to get the women pregnant. So the womb not go running around or moving around. So that the treatment, like a somatic treatment already in psychiatry. Actually, psychiatry hospital, big hospital, always has a swimming pool or exercise place. Actually, exercise started long ago by Germans. That time, they produced a lot of rotation chairs. So you can see they're thinking something wrong, brain congestion. So they spin people around that time. So that's exercise psychotherapy or exercise therapy already. So we're very much advanced than any other medical discipline. And nowadays, we talk about gut flora. So infection, bacteria, related to brain, they call this, call that. Actually, we know that long before. So they use the surgery to take out all the places happen to be very liable for infection. So they think infection causes mental illness. And then what do? Take the infective part out. What's the most part infected is tonsil, uterus, spleen, teeth. So they took those things out to treat the mental illness, surgical treatment. And certainly there's an insulin shock therapy, lasts for many years. So that's the whole history of milestone. What I'm thinking, the psychiatry development, there's a lot of advanced innovation and also disasters. So that's the typical for medical science development, so many disasters, so many innovations. But the most advanced of medicine, especially in psychiatry, are not driven by scientists, are driven by clinicians. So in this way, the clinician observation is most important for advance. For the 20th century, and is pharmacology come up with 1952 chlorpromazine. That's excellent, the clinical observation as well. Anti-tuberculosis, that time, antidepressant medication by accident. And benzodiazepines, that time, by accident. And also the nowadays, recent 50 years, there's great revolutions in the psychiatry, genomic revolutions. So many genes indicated related to bipolar, schizophrenia, and autism. However, all those studies cost billions of dollars. They provide nothing but in theory, and for individual patient, not make much difference. We only know the genetic is a risk, but not cause, and complex, not simple, and genes do not follow DSM. So that's what we got. And also mapping circuit function visually and advanced in neuroscience, and have mapping the human connectome, structure connection, function connection, marker connection. Everything important is connection. So that's in neuroscience. So what does neuroscience teach us? Neuroscience teaches us mental health as a brain disorder. We know that 1,000 years ago, so that's why we drew a hole to get the mental disorder treated, right? Circuits matter. That's 关系, that's most important. Connections, we know that. And plasticity give us a hope. So really, neuroscience development not really give individual patient much help, but give us psychiatrists better understanding. So what's the challenge for depression nowadays? We think we know how to treat depression and how we diagnose. The diagnosis symptoms only defined by census, reliable but not valid. So decided by expert. So if according to the diagnosis standard, we have more than 200 combinations to diagnose depression. And normally depression will be later symptoms after brain disease. Okay? And we only focus on the brain disease symptom. We don't know what caused depression. We know the depression symptom. What's the treatment we offer? We all know psychiatry to do biopsychosocial, but in reality, medication not much innovation. Psychotherapy very effective, but how much psychotherapy we give? For how long? How many sessions? There's no standard. The treatment depends on therapist, not by patient. So if I'm very good at psychoanalysis, any patient come to me I give psychoanalysis. Just like a patient got cancer, go to internal medicine, they give radiation and chemotherapy, go to surgery, they got surgery. But in psychiatry, more or less the same thing nowadays. We treat patient according to our expertise rather than according to the patient need most of the time. So what's the future direction then? What we can do? So right now we're talking about technology to transform mental health care. And we know the machine learning can beat the best chess player, can do so many things. Why not emphasize what we can do in mental health? So before that, Yanbo talking about the digital therapies. I want to talk about the digital phenotyping. So this concept is so important. We're always talking biomarker. Right now we should talking digital phenotyping. So movement by movement qualification of individual level human phenotype in situ use the data from smartphone and other personal data device. That's called digital phenotype. So we fully equipped called the quantified self. So digital phenotyping, there's two kinds of data we collect. One is active data, and the patient symptom diary, questionnaire, patient report. But the most important is the passive data, information gleaned from regular use of those screen activities, GPS data, online data, and keyboard data. So those are passive data. So those how those data are captured, just like I said, passive, active, and use smartphone and in our daily life. And also, how about those data we collected? So most time we collect data, believe what we need, what we want, or how we use. But nowadays, we collect data, we don't know why we collect data, but we know those data might be useful after machine learning or mining. And then sometimes we figure out ourselves. Let the data figure out why we collect those data. So there's a two-way collect data on purpose and collect data without purpose. So then we use deep learning, try to have some outcome, either depressed, manic, treatment response prediction, just like Dr. Gall just talked about it, and also positive data by people collect, such like battery, location, accelerator, GPS, microphone, sensors, and most will be the keyboard behavior. And those are the data we collect, different studies. And then here you can see there's brief communication, digital biomarker of cognitive function. That will be the key of future directions as a psychiatrist. We call it biomarker. And biomarker mainly, majority of our activity come from touch screen input as a biomarker. And those near future data streams, those not only collect the numbers, digital, sound, visual, but right now we can have facial recognition, but also facial recognition about the emotion, cognition. And the voice the recognition, not only the content, sometimes the collected data is not content dependent, but it's kind of tone dependent. So the benefit of digital phenotyping is very easy to collect, cheap, scalable, and very easy to connect it to the e-health. But certainly there's a lot of challenges sort of coming, collect a lot of noises, how to do it, okay. And also important is privacy issues, where is those data stored, how to manipulate those data, how to unmask those data, and between maximizing signal and maximizing intrusion. So this is data. So where are we in the digital resolution? Why are we? So we are just in the beginning of using digital tools to map and understanding behavior. Digital phenotyping is a shiny, emerging technology with great promise. The combination of sensors, big data sets, and machine learning likely transform how we measure and describe behavior. And mental health and dementia will be a new frontier for wearable artificial intelligence monitoring and innovative intervention. So here is my last slide. We always monitor, just like Yanbo said, should be therapeutic, digital therapeutic. Here is a brain-computer interface. Collect data, give it stimulation, later on some intrusive interaction. So next revolution in psychiatry will be brain-computer intervention. Not only collect simple and use those signals to direct intervention. And the intervention, most intervention nowadays, RTMS or electric current, more or less is minor or no intrusive kind of behavior, intrusive modality. But the future, probably more effective will be, we prefer intrusive with the brain and the computer interface. This guy, Musk, and proposed to have thousands of electrodes get into our brain to detect something or do something. Okay, so that's my part, and just try to summarize today's session And we have all those new innovation is so exciting where we go. There's 10 years looking back, maybe we do some other disasters, just like we did 100 years ago, have a lobotomy. We can only progress and try to have innovation. And innovation is effective, benign, may not be. So we have so many disasters, and we have to be careful. Thank you.